to Louisiana Living.
And welcome back. I'm here with Dr. Muhammad Bakir with the Surgery Clinic of Northeast Louisiana. And October is Breast Cancer Awareness Month, and we are here to talk about the signs and symptoms and what you should look for as a female and male in your home. Dr. Bakir, thank you so much for joining us.
Thanks
it's great to have
me.
you. What are the signs and symptoms of breast cancer?
Yeah, so the main things people look for with breast cancer, a lot of people may feel a lump. That's the most common thing people think about is I felt something abnormal in my breast. It may just be as simple as some swelling in the breast. It could be some breast or nipple pain. It can be breast discharge or nipple discharge, or even just some dimpling of the skin can be signs of breast cancer. Most commonly, the people we see that come in that have breast cancer, though, have no symptoms whatsoever.
That's what I've heard. We've had someone come on and they said 1 in 8 women can have, will be diagnosed with breast cancer, and then men can get breast cancer as well.
Yes, ma'am. So breast cancer is probably the most common cancer that you'll see in women, like you said, 1 in 8. Even so, men still can get breast cancer. It's about a rate about 1 in 1,000 getting men, but it is something that we do try to look out for in men as well. The signs may be similar as you might find in a woman, and obviously similarly to women, the earlier we catch it, the better the results. But with men, unfortunately, we see poorer results because we tend to catch them later because they don't know the signs of it.
Because women have the yearly mammograms if they follow that protocol. When, at what age should you start mammograms?
Correct. Yeah, so the American Cancer Society generally recommends you starting to get your mammograms at age 40 for the average risk woman. Some of the people that might be higher risk, we may say to go do it a little earlier. Generally no earlier than 30, though, would be looking for routine mammograms. But generally it's an annual mammogram at age 40 to try to see if there's any kind of signs or symptoms that might be developing. At the same time, we talk about self-examination. It's not something that you should be commonly doing all the time necessarily, but you should also have an awareness, though, is what we tell people, of what might be different in your breast. So if you're noticing something off or unusual, that is something that you should bring up to your physician.
Does a lump always have to be painful?
No, ma'am, it does not, and a lot of times they aren't actually painful. The ones that we actually see are painful, a lot of them may not even be cancerous. We see things like abscesses and cysts and things in the breast of such that don't actually end up. And a lot of younger people even, while they may be concerned that they have a painful mass, and while it still should be brought up to your physician, they end up being a lot of benign things actually.
One of the things I wonder about is under my arms. It seems like maybe that might be a spot that I miss.
Correct, and so the breast tissue actually can extend into the underarm area. The other thing to look out for too is a lot of cancers spread through the blood. In the breast, it actually spreads through the lymphatics. With that said, the lymph nodes that it actually spreads to first would actually be under the armpit as well. So if you feel anything off or unusual, it can be a sign of those things as well.
And talk about the importance of early detection.
Yes, so the rates of survival are dramatically improved the earlier that we catch them. In the stage 1 tumor, and the staging system looks at a combination of things based off of the size of the tumor, as well as whether there's signs of spread. In the stage 1, which is the lowest, the stage 0 would be the lowest, it hasn't invaded anything yet, but stage 1 being the early stage tumors, the survival rate is greater than 99% for 5 years. In a person that's a stage 4, which is the most progressed form of the tumor at that point, the survival rate is actually about a 32% chance of 5-year survival rate. So that's a dramatic difference. Overall, though, we have come a long way in the treatment of breast cancer. The overall survival rate for 5 years is about 90% or so. So there are a lot that we can do to help you, regardless of where you sit on that staging system, to where no matter what time we catch it, it's still worth talking to someone about it and making sure that you're getting the best options that you can.
That's comforting to know. Dr. Bakir, thank you so much. Always great to have you.
It's always good to be here. Thank you for having me again.
Thank you.